Hello, everyone, and welcome back. We're on the topic of engineering the cardiovascular system. And so far, we've looked at the significance of cardiovascular modeling and cardiovascular diseases, epidemiology, and we've also looked at the history of cardiovascular models as they've developed from hundreds of years ago, from the very first observations up till now. And so now we're going to actually continue that discussion. And in this lecture, we're going to look at the anatomy of the cardiovascular system in a lot more detail. So as you remember from the models of the first lecture, we've just understood that the idea of circulation came about starting from William Harvey's observations, that the heart and lung were connected, and the heart was also circulating blood to the entire body. So now we're going to look at this from a lot more, from a perspective with a lot more detail. So we're going to look at the human cardiovascular circulation circuitry, and to start, we're going to understand some of the terminology here. So the arteries are the vessels that carry blood away from the heart. Veins are vessels that carry blood back into the heart. Okay. Systemic circulation refers to circulation that happens between the heart and all the other organs. The pulmonary circulation is what happens between the heart and the lungs. Basically, in systemic, we carry the oxygenated blood to the organs and return it back in the deoxygenated form to the heart. And in the pulmonary circuit, we have the deoxygenated blood that has come from other organs, pumped to the lungs, and then once it's oxygenated, it's sent back to the heart so that we can then pump it back to the rest of the body. This is the entire loop. So if you look at it here, we have the left ventricle, and the reason we call this left is it's the left of the patient. The left ventricle that pumps the oxygenated blood through the aorta all the way down, and it goes first through the arteries, then the arterioles, which are finer in dimension, to the capillary beds, and then back through the venules to the veins. Once it gets to the veins, it gets to the vena cava. These two channels bring the low pressure, low oxygen blood into the right ventricle. Again, it goes first through the right atrium and then the right ventricle. And then this is pumped to the lung through the pulmonary arteries. Again, remember, pulmonary means the network that's connecting the heart to the lungs. So pulmonary arteries that bring it all the way to the lungs. And then the lungs are going to oxygenate the blood, sending it over to the heart. And again, the pressure drops as it goes through the lungs. So now the left atrium and the left ventricle that then pumps it back has to pressurize it before it hits the aorta and goes through the rest of the body. So that's the entire loop. It's a very interesting, beautiful system here as it circulates back and forth. But as you can see, an important factor here is the fluids, the fluid mechanics that governs this system, because we're talking about pressure drops in these networks, we're talking about flow rates, and we're talking about all sorts of mechanical deformations in these blood vessels and the heart. And so it's a very intricate system that we are actually looking at today. So a bunch of other jargon. Anterior and posterior means front and back. These terms you will be seeing in the next couple of anatomical models and images. So it's necessary to know what anterior and posterior mean. Superior, inferior, up and down. Proximal, it's the proximity or towards, closer to the heart. Distal means it's the extremity or further away. Lateral and medial mean the sides or the middle. of the organ. So this is the full network, again, from a different schematic here. You can see the lungs there have their own pulmonary circulation, and the rest of it has the systemic circulation that goes through the head, the arms, and various other organs, the kidneys, liver, legs, and so on and so forth. And we've got the arterial side and the venous side. So this is the entire loop or loops that we're looking at here in the cardiovascular system. Now, to get into more details of this, the circulation network fills pretty much the entire space of our bodies with a very fine packing when it gets to the capillary level, and it has this branched fractal-like geometry, which we'll look at the physics behind this and how these branches look like in terms of their geometry from the mother vessel to the daughter vessels. In the next couple of slides and the next lectures, we'll be talking about that more extensively. And the area, as you can see here, has to increase as well, because as we go from the main, aorta through the arteries and then the arterioles and capillaries, the idea is that we have more and more surface area to exchange oxygen and nutrients with the tissue. So the surface area is going to get increased as we travel through the system. And then we've got the heart. And the heart structure, as I mentioned again, consists of the left and right, the left atrium and ventricle and the right atrium and ventricle. And the idea is that it's very much like a positive displacement pump. It actually brings blood flow in, squeezes it, pressurizes it, and pushes it back. And what you can see here is that this oxygenated blood starts from the left and is pumped through all the way through the aorta to the circulation network that we just looked at, and then the circulation networks bring it back to the right atrium, and it is then going to go through the pulmonary circuitry and then hit the left side again to be pumped back to the circulation. So again, that was a recap of the structure. Now, involved in this are various types of valves. Now, what these valves do in the cardiovascular system is they maintain a one-way functionality. So they hold the pressure, not allowing the blood here, for instance, in the left ventricle to go back to the atrium when it has to go through to the aorta. So they keep it locked in certain timed periods as beautifully timed and synchronous activity. So this valve here, the first one, is the mitral valve that connects the left atrium to the left ventricle, where you actually have the introduction of this blood, fresh blood, pumped through the aortic valve to the aorta, which is then circulated. And on the right side, you have the tricuspid valve. And the reason it's tricuspid is got 3 leaf sections, whereas the mitral valve only has 2. It's called the bicuspid valve. And then what you have here is that this tricuspid valve allows progression from the right atrium to the ventricle and not the other way around. And then it actually goes through to the pulmonic valve, which, as the name suggests, it then brings it to the pulmonary circuitry. If we look at the heart, the main part of this circulation circuitry, we will see that we have the aorta here. This is the arch of the aorta with 3 main branches coming out of it. One goes to the head, and we'll see where the rest go. And then the main one, the largest flux, goes through this part, going to the rest of the organs. Then you've got the vena cava, which I showed before. You've got the pulmonary arteries and the pulmonary veins. What they do, again, the arteries take the blood to the lung, these pulmonary arteries, and these pulmonary veins bring it back to the heart. And the reason you have 4 of these is because it started to branch immediately from the heart, and I'll show it in a different image here. So again, here, another part is before it reaches the aorta here, and the aortic arch, or the arch of the aorta, a bit of the blood is going to be consumed here just to give all the nutrients needed to the heart itself, because the cells in the periphery of the heart that build up the heart also require oxygen and nutrients. So right here at the stem of the aorta, it's going to have some branches feeding the heart itself through the coronary arteries. And then we're also going to have coronary veins, of course, that are going to bring back the heart. But this happens right on. Then the majority of it goes through the aorta. Again, as I mentioned, part of it goes through those 3 sections, and the main part goes to the rest of the organs through the aorta. Here, you can see again where those 3 parts come from the aorta. So again, this is the aorta, the arch of aorta, and these 3 go to the subclavian, and the brachiocephalic trunk, the arm and the other back regions, and part of it goes to the head through the common carotid artery, which goes up through the neck and to the head, as I'll show in a minute. So this is the main, this is the main channel that carries the entire blood coming from the left ventricle all the way to the rest of the body. As you can see, it's already started its job here. And here is the structure of the neck. So you can see that the carotid artery here, I think I've got a better image here. The common carotid artery is right here. That stems from that arch, as you saw before, and divides into an external and internal carotid artery. The internal goes to the brain, the external goes to the rest of the head. And so this happens right here. So if you see again, you'll see the arch, and you'll see one section, one branch that's just going to the carotids, which are going to feed the brain. And this is the lung. Again, as you can see, the branching has happened here, and you've got the pulmonary arteries, and what they're doing is they're carrying the low oxygen blood to the lungs. Here they again blue because it's the low oxygen, and then the pulmonary veins are going to be the ones that are going to carry the oxygenated blood to the heart, and that blood is then going to be sent over through the left ventricle to the rest of the body. And this is the structure of the lung. We'll look at this in a lot more detail in 2 weeks' time, but the idea is, again, it's full of these vascular beds that exchange the oxygen from those alveoli and alveolar sacs with the air in them to the blood flow going through this circulation, and then they send it back through the pulmonary vein. They send back the oxygenated blood back to the heart. So it's also interesting to know that these pretty much run in parallel. So you actually have a parallel periphery for the arteries and veins. Pretty much in every part of the body, they sort of have this general parallel structure where you have the same route in parallel from the oxygenated to the deoxygenated, from the artery to the vein. And a final bit of anatomy here for you to just complete your understanding of the heart is that the structures that I mentioned here are not identical from one patient to the other. This is very important that you take away this message, because this is an important part of why we have to have personalized medicine and personalized treatments and patient-specific treatments, is that the geometry of every one of you, in terms of your hearts, your the different anatomical geometries involved in various organs, is going to differ significantly from another. So what you see here is, for instance, even in the case of your coronary arteries, you see significant variation from one patient to the other. They are naturally morphogenetically grown structures, so they're not always going to look the same. They're actually always going to look different. And so that's why if you're deploying a stent or if you're looking at balloon angioplasty process or similar, you're actually going to have to take images of that patient, and the procedure is going to be different every single time. And we'll look into this a lot more in towards week 9. And finally, again, this is another slide showing the variations. This is for renal arteries going to our kidneys. And what you see here is, again, a significant difference, even in the main branches as they branch back here. You see in some patients, we see multiple branches right from the root. Here we have one branch that then branches down to more as it gets closer to your kidneys, which is really interesting. It's bizarre how these bridgings and branchings and different types of fractal geometries appear purely based on the environmental effect and influence of your individual bodies and internals. So with that, we have summarized our anatomical discussion on the cardiovascular system. Hopefully you've understood the various regions. So when we use these terms and when we look at these different subsystems in our next lectures, you will understand and know where and what we're referring to. So please review these slides and this lecture as many times as you need to at least understand the main subsystems and components of the cardiovascular system. This will actually come in very handy, necessary for the rest of our study of the cardiovascular system and engineering the cardiovascular system. So with that, I'll leave you there for this second lecture of the series, and we still have a couple lectures remaining for the asynchronous for this week, and also still looking forward to meeting you next week to talk more about the biofluids and review of these lectures. So hope you've enjoyed it so far. Keep tuned and keep watching for the remaining sections. Take care. Bye.